So today we're taking a look at fractures in children. What are fractures in children? I guess a lot of us have at one point or the other had a child or have children who have fractured bones, and then you remember what you went through. And for parents who do not have children who have gone through this, well, that's a good one for you. But you have to know a few things about fractures in children in case your child have this. So what are the causes of fractures? How can fractures be managed? And are there emotional or psychological issues with fractures when you're managing it? Well, you get to know a lot of this on the show today. And of course, we went to town, we sampled the opinion of parents or people on what fractures are in children, or maybe how they managed fractures when their children had. You get to know their reaction on this. Also, we have a package for you also on fractures in children. This and more we have coming to you on the program today. Welcome. I'll be back right after now. While still on Children's Clinic, Dr. Israel Olasode Akinmokun, who is a consultant orthopedic and trauma surgeon, will be here and he'll be talking to us on managing fractures in children. All right, welcome again on this segment on Children's Clinic, and as you know, we're talking about mismanaged fractures in children. Thank you for joining us on the show today.
Thank you for having me.
All right, let's go straight to talk about why we're here. Let's talk about what fractures are in children.
Well, let's just say it in plain terms. Fracture means broken bones. And we all know that bones are a very important part of our human body because they serve different functions. And when such or a part of bone is broken in the body, that's what we call a fracture. But fractures is very important or very interesting in children because sometimes we may have some type of fracture, unlike in adults, which bones in adults is usually very brittle. And so therefore, when it's broken, most times it may be broken through and through. But in children, we have different types of fracture that can happen in children. Sometimes a part of the bone may be broken. So we may have what we call a green stick fracture. Also, sometimes we could have what we call a thorus fracture. All these are types of fracture that can happen. Thorus, yes. Okay. Or buckle. Okay. As if when something compressed on each other. Oh. Yeah. It can also happen in children. So we need to actually be careful whenever a child has a fracture because we must treat it appropriately so that the outcome will be good for them.
Okay. All right. Now, having known what fractures are, at what point does it now become a mismanaged fracture?
Yeah, a fracture will become mismanaged if the outcome of that fracture is not what we expect it to be. Usually, fractures, whenever it happens, there are different components that could happen with the fracture. Sometimes when the bone is broken, the natural way in which the bone is lying may have been displaced, and that we call it displacement fracture. And if such fracture is not properly managed in such a way that the alignment, the length, and the rotation of the fracture is properly maintained the way it was before the fracture happened, then it could cause a problem for such a child. And so if such fracture is not managed by a competent doctor or a competent person, in this case it would be an orthopedic doctor, and when the outcome now comes, then we say that fracture is mismanaged.
All right, doctor, then let's talk about the causes of fractures apart from accidents. What again could cause fractures in children?
Thank you very much. Well, accident is the most common cause of fracture in our environment. In other climes, it is not. Apart from that, fall is also a very common cause of fracture after accidents in our society. But I must say this because I did a study on fractures of children some years ago, and I found out that most of the fractures that occur from fall actually occur in homes. And our homes are meant to be safe for these children. And so we should be careful whenever our children are at home. And I also find out in that study that most of the fracture that happen at home happened because the children were playing unsupervised. There were no adult presence when they were playing, and so therefore the fracture do happen. And so if that be the case, I would just beg all of us that please, we should supervise our children when they are playing, and also please let us make our home safe. So
that might be very difficult because sometimes the parents are not at home and the children want to have their way.
Yes, they can have their way, but there should be an adult presence so that I'll be able to tell them, oh, don't jump, oh, don't do this, oh, don't do that. Because children, they are known to be very adventurous.
Yes,
they want to check everything, they want to test everything. And even also, some of the other causes of fracture will also be maybe, in that study also, I found out that a fracture occurred because a child went to where they were parking a motorcycle and was playing with it, and the motorcycle fell on that child. Also, a child was playing around the wardrobe and something fell upon the wardrobe. Some were playing with the curtain railings, it fell on them. So different things can cause fracture. That's the reason why I said we have to make our home safe, such that children will be supervised every time, or most times, to avoid fracture from happening.
All right, thank you very much. Now, I've enumerated that. We've known some of the causes of fractures, and then now it's time to talk about how to manage these children with fractures. Sometimes the parents get to know very late. Sometimes they even get to know early enough. But how do you, as a parent, manage your child with fracture?
Thank you very much. I think what I would say is this. Once we suspect that a child is injured, the best thing to do is to take the child to the hospital so that necessary tests, necessary examination will be done for us to be able to identify if that child has sustained a fracture or not. Now, I know that a lot of people have been saying that fracture is better managed by some people outside the bone setters.
We'll get to that.
Okay, yeah, but I need to say that now because we find out that sometimes people around you that are advising you to do that may not be telling you the whole truth about patients that were managed by those bone setters. They will not tell you the whole truth. I once had an encounter with a patient that we were to manage, and then somebody came outside and was telling the relative of that patient that, oh, he has been to a bone setter, his bone has been broken before, it was the bone setter that treated him, and then he wanted them to go to the bone setter. He was arrested by the police. And by then they questioned him. He had never had a fracture before. Talk less of being treated by the bone setter that he was talking about.
So why was he lying?
Just because sometimes some of them do have a bait from those bone setters. And so they would rather tell them, oh, this Baba, we know the Baba very well, and so let's take the Baba there. And let's take the child there. But they will never tell you the whole truth. And so we need to be very, very careful. So I would say when a child sustains a fracture, take the child to the hospital and let the any doctor should be able to see and identify a fracture. And when they are in doubt, they will send the child to go and do x-rays. By the time they do the x-ray, we'll see the fracture, and just such a child will be well treated. And I must say this, because one of the fear of parents is that whenever they say they are going to the hospital to go and treat fractures, that, oh, it may result to operation. I must say this, that in children, about 70 to 75% of fractures in children are managed conservatively. What do I mean by conservatively? Yes, they are managed with the use of plaster of Paris alone, POP, in which the child will carry for maybe 3 weeks, maybe 6 weeks, and then we'll just remove it, and the hand will be fine, without causing any further trouble for that child.
Okay, now talking about the time factor, there was a clip I also watched. Somebody said he went to a bone setter. First, initially he went to the hospital, and that he was just abandoned at the bed there without any treatment and nothing. Eventually, he had to go to a bone setter who promptly started treating. I want you to react to that.
When people say that when they come to the hospital, they just put them on the bed, I just wanted to realize that even that bed rest on its own is a form of treatment.
Okay.
I always say this to my patient that I come across, that, okay, take for instance, if any animal is hit by a car, I'm talking about maybe dog, maybe cow, or maybe goat, get hit by a car, they will just go and stay somewhere for some time. And then before you know what is going on, that bone will heal. So rest in itself is a form of treatment. So by the time you are on that bed, not moving around, it's a form of treatment. It's not until when somebody starts giving you injections or start doing some manipulations that you should think that you are being treated. Yeah, the bone has the power to heal itself. The function of the doctor, the orthopedic doctor, is just to make sure that that bone heal in a normal alignment, with normal length and with normal rotation, so that there will not be any problem. Because if the alignment is lost, then the patient will not be able to walk properly.
That's why you have short arm or
yes,
short legs.
Short arm or short leg, because of that, length or the malrotation that may happen. And that is when we come in. Our whole duty is also to make sure that the bone heal in a proper way, in an acceptable way, such that the patient will be able to use that leg or the arm appropriately. And so the issue of being abandoned is never there.
That's why I think education comes in. Maybe having to talk to the patient to let them know that you've been here, even just being on breast is a form of treatment on its own. Okay, now let's talk about the emotional trauma that patients go through when they suffer any form of fracture and they are hospitalized. Is it necessary you administer some form of test on them to counsel them emotionally? Yes,
I must agree that whenever a child sustains a fracture, more than the emotional aspect, which is very, very important and very, very significant in the management, also financially, also the patient parents will be distressed. Then there will be loss of manpower because they may not be able to go to work. So a lot of things actually do come with such fracture in children. And you are right, we sometimes also, most times, talk to the parent about the fracture, about the prognosis, as in the outcome of the fractures, about how long it will take for the fracture to heal, and they try to allay their fears so that they'll be able to understand that the bone that is broken can heal without any problem. So far, it is well treated.
Okay. Now, again, the child that is suffering the fracture and who is going through the pains, do you also at times, prepare them emotionally or try to psych them up?
Oh, yeah, of course. Because we know that anybody that has sustained a fracture is usually very, very painful. And so, one of the things you need to do is to make sure that at least you give them pain reliever to relieve the pain. And then also for those that are old enough to understand, you need to talk to them about what has happened to them. For those that are not old enough to understand, you need to show a friendly face. Because one thing is that children don't have enemies. If you are friendly to them, they will listen to you and they will allow you to touch them. But if you are not, and if you are not patient enough with them, then they will not allow you. And I think one of the things that we do, especially for some of us that manage fractures in children, is to make sure that at least when such a child comes and meets us, we make them feel comfortable around us, such that at the end, everybody will be happy.
Okay, now let's talk about first aid measures. Are there first aid measures a parent or a caregiver could go to a child if you are with them and they fall down or something, you notice that there's a broken arm or something? Other first aid measures parents could learn to administer them before taking them to the hospital?
Oh yeah. Usually when such a thing happens, what we advise is that we first of all need to understand what happens when a bone is broken. When a bone is broken, usually there will be swelling around that particular area. It will be painful, and then such the hand or the leg will not be able, the person that owns the child will not be able to use the hand or the leg. And so once you notice these three things, the only thing we can advise is that you can just first of all try to put a newspaper, just get some pack of newspaper, just put around that place and just slightly put some cloth around it. Don't let it be too tight, okay? So that you just immobilize that injured place. Once you immobilize it, the pain will be reduced a little. And then you can, if you have some analgesic at home, you can give some before you come to the hospital. But like I said, the best thing is to go to the hospital as soon as possible, so that doctor will be able to examine you appropriately and be able to prescribe whatever is necessary for you. Because for us to treat fracture, I'm sorry to say that, the treatment is supposed to be as soon as possible.
Okay. Again, I want to go back to the issue of the traditional bone setters. You know, when there are fractures, for those people who have gone there, they tell you the first thing to do is also to pack, just like you have rightly said. Are you saying in totality it is wrong, or people shouldn't patronize these traditional bone setters? What to stand on this?
What I will say is this. Based on what I have seen in my practice as an orthopedic doctor, I would say choosing to go to a traditional bone setter, it should not be it. And I will say why. Because number one, the people that we have seen that have been to traditional bone setters have been to our centers before. I mean, sometimes some of them come with what we call malunited fractures.
Malunited?
Yes, malunited, meaning that the fracture is not united. The fracture may have healed, but it didn't heal properly.
Okay.
Take for instance somebody that has been to a traditional bone setters and has one leg is longer than the other and shorter than the other, or maybe there is now some angulation. I mean, the leg is now looking like as if there is a
not straight.
It's not straight. It's bending somehow. And then we even had patients that are presented with us with what we call gangrene. Gangrene is when a part of the body is dead. Yeah, and so in this study that I told you about, out of all some of the children that had fractures that went to traditional bone setters and came to meet us came with gangrene, in which we now had to cut off that limb. And you know, what people will say is that, oh, it was in the hospital that they cut off the limb. Nobody will ever say that, oh, it was because they went to a particular person that the limb went dead. And so they give the hospital a very bad name, just to make sure that people don't come there. Whereas what we are doing is to make sure that at least that patient is still given a lifeline. Because if a part of the body is dead and you allow that part of the body to die, I always give this example. If we have 1 million apple and one of the apple goes bad, if you do not remove that one that is bad, so that whole 1 million will get spoiled. Right. And that's it about life also. So if a part of the body is dead and gangrene and it's causing infection and it's going to kill the patient or the child, we rather will remove it such that we will prevent life from being lost. And so from the experience of being an orthopedic surgeon and from people that we have treated that have been to traditional bone setters at one point or the other, I would advise that it's best you present at the hospital for you to be properly assessed. In fact, I once had a case just a few months ago. I won't say so much about it, but the parents were enlightened. The father is a banker. I won't talk about the mother so that I won't give so much information. But this child fell and had an undisplaced, just the bone is broken, but the bone was not shifted. All what we needed to do for that child was to just put in a POP for 3 weeks and the child will be fine. But they went to a traditional bone setter. By the time they came to us, the land was bad, was dead. The mother was crying, and because the only option we needed to do then was to just cut off their limb. Just because of that singular way in which they have treated that fracture. And honestly, that fracture will have done well if you have just put
3 weeks.
3 weeks. If you have put off the POP.
All right, thank you so much for your time. Before we wrap it up on this segment, your final word of advice for parents who have children who are young and who are restless, just like you said, who if eventually they have this type of fractures, what do you want them to do?
Okay, I would just say, parents, please, the best thing to do is to prevent fracture from happening. So I will say this: please stay around where your child are. Talk to them, let them realize that some things are very difficult and may cause fracture, some may not. And then also, if you have a child that has sustained a fracture, please go to the hospital and let that child be seen and be treated by a competent orthopedic surgeon. Thank you very much.
All right, thank you very much, Dr. Israel Olasode Akinmokun. Thank you for your time.
Thank you.
We hope to have you some of the time.
Thank you.
Children's Clinic continues in a moment. Please stay with us. I'm sure you have been informed about watching that interview. Well, I have been informed, and parents will know that the first thing to do when your child suffers a fracture is to go to the nearest hospital to get adequate guidance so that you don't mismanage the fractures. You heard what the doctor said, and I know that it's quite frightening, but you can't help make your child come out of whatever he or she is going through by getting the adequate advice from the doctor at the right time. Still on Children's Clinic, in case you're just joining us, the program is Children's Clinic, and it's a program that has to do with the health of your child. Today we're focusing on fractures in children. We also went to town, we sampled the opinion of people on fractures in children.
I think I will go for traditional. You understand? It's more reliable, and also for those that we have seen, that we have had. You understand? I'm even a study case. You understand? At the point I broke my leg and I did naige. Do you understand? It's not. I'm not saying that the modern setting is not good, but the fact is that we should all appreciate our own natural culture, and also things that we are Yorubas. You understand? You are Hausas, we are Igbos. There are better ways of doing things rather than using modern medicine to do it. I think I'll go for traditional medicine. It works.
We can't just eradicate our natural stuff, all because they still have their own quota to take in it. What is there is that let's assume I'm having a malaria issue now. I'll just try to go to the hospital and identify exactly what is doing me. If I might support it with the traditional medicine, I can see, but I have to take the necessary things from the hospital first. All because they know exactly what is happening to me. And for them to know exactly what they will use. They have all the educational activities, all what they need. All the education about it, exactly what is doing me. They can use maybe like an instrument to identify exactly what is wrong with me. But for the traditional one, they were just trying to be using their own thinking. They won't know exactly this is what is doing me.
I don't know much about these bone setters, but I used to hear it, like all these malam, they do it. But I'm not used to it, so I wouldn't want my ward to do that.
As for me, I prefer to go to traditional medical treatment, you understand? Because the issue is that during our forefathers, you understand, our green leaf is very useful for us since then up to nowadays, you understand? Because as the useful of the green leaf is very important than all these modern equipment that they brought in from the other countries, you understand? Because as for me, I use herbal medicine as well. So, and it's very okay and it's good, it's working well for me. But in the other way, I can still support the modern medical treatment, because as of now we have sufficient equipment, and we have modern equipment that anything that is wrong with the bone fracture, the machineries, the equipment will bring out the errors, you understand? In which those days we don't have the equipment. So I can treat my child, my wife, my family entirely with our traditional herbs.
The herbal medicines, they are very efficacious. Are you getting me? Why I'm saying this is that I'm not condemning orthodox medicines. They are working fine. But when it comes to certain level, orthodox medicine cannot do it. As you see me, I take Agbo as well. There are some ailments, like last 3 weeks, I had chronic malaria, no minor one, no chronic one. I took, that is orthodox medicine. The malaria didn't go on time, and I had to go back to my own product. I took it, and the malaria gone. Anything pertaining to herbal, you cannot compare it with orthodox medicine. If anybody is having bone problem, I will advise them to go for the one herbal.
because I won't prefer that of a traditional whatever. Mainly, they'll ask more and more of money from you. You get? They ask more and more of money from you, and then each time you have problems, there will be special things they will tell you not to do. Once you do it, it continues gradually, continues gradually. But for doctors, they will tell you the specific medicine, what you use for it, and how many times, that's daily, what you use daily for it, and also the kind of food you have to be taking gradually, and to give yourself a number. There will be a specific hour they will let you know to give yourself rest onto.
I wouldn't say until it happens, but I pray it doesn't happen, because you wouldn't say which one is more effective than the other until you try them.
Well, this is all we're taking today on Children's Clinic. I hope you have been informed and educated. I have been informed and I have been educated. And so we talked about managing fractures in children. So remember again to join us next week for yet another edition of Children's Clinic. My name is Jumoke Adesua. Thank you for being a part of the show. Have a great day.